Hi, it's Michael from Planet Naturopath, and today we're going to talk about cardiovascular disease and your genes. There's a lot of conflicting advice out there on what the best type of diet is, whether you should eat high fat, low fat, what the best type of exercise, endurance, or short, intense exercise, whether you should drink alcohol or not, and we all know that smoking is bad for you, but we hear stories of people living to 100 and they smoke their entire life. So how does that work? Well, often it comes down to someone's genetics. And just because you have the genes for a particular condition doesn't mean you're going to get that condition. So you might have the genes for some of the key genes for cardiovascular disease, but knowing this information can help guide you on what the best type of diet and lifestyle is for you to reduce down that genetic risk so that you don't have to have cardiovascular disease, stroke, or anything like that as you age. Let's have a look at the cardiovascular template, and I'll explain what I mean. This is in an app called Livewello, which you can upload your 23andMe data to. Here's an example of the cardiovascular risk factors template. I won't go through all of these genes, but I'll just pick out a couple of them. The ACE genes and the AGT genes are to do with blood pressure. ACE stands for angiotensin converting enzyme, and it's a potent vasoconstrictor. ACE inhibitors are a medication to help lower blood pressure. So these genes can, especially if they're red or homozygous, can increase your risk of blood pressure. This client in particular has high blood pressure on one side of the family, and on the other side it's fine. So they've picked up copies of these genes from one particular side of the family. Other genes that are really important are the APOE genes, particularly the APOE4, which not only gives an increased risk of cardiovascular disease, but also an increased risk of Alzheimer's. That's because there's an increased risk of beta amyloid plaque buildup in the brain. Just because you have these genes, though, doesn't mean that you're going to get these conditions. And in fact, knowing that you have these genes can help you be proactive in actually reducing down the risk. So there's a lot of things you can do to actually help reduce the APOE risk. Things like good quality sleep, good quality diet, and particularly higher intensity exercise. When it comes to diet, I often recommend a high fat diet, but in this particular case, probably a moderate or a lower than a higher fat diet would be a better choice. And particularly cutting out all the omega-6 industrial processed oils. So getting good quality olive oil, macadamia oil, coconut oil, and fish would be vital here. I'd also recommend taking supplements like turmeric and resveratrol to help with this APOE gene. Other genes that are interesting are the CYP1A2 gene. This is how quickly or how slowly you metabolize caffeine. So studies show that coffee, for some people, can actually protect against cardiovascular disease. And these people are fast metabolizers of caffeine. But slow metabolizers, this protective effect doesn't apply, and in fact, caffeine can have a negative effect. The FADS1 gene stands for fatty acid desaturase, and that sort of gives an indicator of how much fish oils or fish you should consume in a week. So particularly if someone is red here, I'd be particularly make sure that they have 3 to 4 serves of fish a week or have a daily fish oil supplement. And the MTHFR gene affects the health in so many different ways, and including cardiovascular disease. So this can lead to high levels of homocysteine, which is an inflammatory marker, and can lead to more clotting, so that can increase the risk of heart disease. So all these genes have an impact on how you should eat, whether you're protected against things like alcohol or whether alcohol is beneficial, what the best type of exercise is, and what type of supplements you should take to reduce down your risk of cardiovascular disease. So we just touched on a couple of the different cardiovascular genetic markers. And as you can see, there's a lot of different things that influence cardiovascular health. If you're genetically predisposed to high cholesterol or have the APOE gene or any of these other cardiovascular markers, I recommend getting a full cardiovascular pathology test that measures not just cholesterol, HDL and LDL like the standard doctor's test, but also markers like apolipoprotein B, VLDL, LDL subfractions, the LDL particle size. These are all much better indicators than the standard test. Plus inflammatory markers like homocysteine and high sensitive C-reactive protein. Inflammation is the driving force still behind cardiovascular disease. So while you might be genetically predisposed, if you can keep your inflammation down, you're going to reduce down your risk of heart disease. For more information, go to planetnaturopath.com, or you can contact me at michael@planetnaturopath.com, and I can organise the pathology testing, and let me know if you'd like more information on the genetic test or a more detailed analysis for yourself. Thank you.